In general, it's very rare to get a primary hernia at any other location aside from your belly button and your groin if you have not had previous surgery at that location. It happens, sure, but it's definitely the exception, not the rule. This is rectus diastasis 99% of the time. And so rectus diastasis is essentially when the strong tendon that holds your ab muscles together, your six-pack muscles together at the middle, gets weakened, thinned out, and widened. And as a result of that, your ab muscles pull to the side. And when you exert any pressure in your abdomen, we call that valsalva, like doing a sit-up, getting up out of bed, coughing, your midline bulges out. Kind of looks like alien head coming out of your midline. And so a lot of people think that's a hernia, and I get probably 4 referrals a week in clinic for, patient has large midline hernia, and it's not a hernia at all. It's rectus diastasis, which is also sometimes called diastasis recti, just the 2 words flipped around. And that's Latin for just widening of your rectus muscles. And so when that happens, technically it's more of a cosmetic problem than a functional problem. Insurance companies in the United States don't believe in it being surgical pathology, meaning your insurance company won't pay for you to get this fixed, which I think is a farce, and we can talk about that later. But in general, fixing rectus diastasis, meaning like plicating or sewing together your ab muscles back together to make that tendon strong again, is a little controversial in the general surgery realm. It's actually part of a plastic surgery procedure, part of a tummy tuck. It is one of the parts of the tummy tuck where, 1, they plicate your rectus diastasis and bring your ab muscles back to the middle. 2, they remove excess skin and subcutaneous tissue. And 3, they do body contouring, usually with liposuction, to give you a nice shape at the end. So in general, women mostly get rectus diastasis after pregnancy with the immense force from the abdomen of the baby pushing on your abdominal wall. Just one of the many gifts of being a mom that your kids will never appreciate you for. And so, say after multiple pregnancies, you're left with, and women usually get it as a football shape, rectus diastasis centered around the belly button. Men usually get it from either genetics, or it could be from weight gain, with all that pressure from the abdomen pushing out on your ab muscles for years and years. And men usually get it in a classic champagne flute distribution from the breastbone down to the belly button. Way to fix it, we can talk about later, but in general, your insurance company will not pay to fix it in the United States. Although I do totally believe that it does destabilize your core over time, it can certainly lead to bad functional status. And we can talk about some videos of how we fix it next time. Because if you have a hernia associated with the rectus diastasis, totally fixable, and that's great. But if it's rectus diastasis alone, that's a plastic surgery thing, and that's a cash pay for your surgery situation.